is time for our amazing presenters. Carlton, can you go ahead and kick us off? And one last friendly reminder, please mute yourselves if you haven't already. Carlton, it's all yours.
You got it, Amber. Thank you so very, very much. And thank you all for joining us. We are looking forward to the conversation that we've been having for the last few weeks and preparing and helping us to think about how we would prepare well for this certification exam. And part of the thing that I really want to get to is the fact that at the Southeast PTTC, we are very, 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 very focused on trying to ensure that we are helping to build the workforce and providing what help and what supports we're able to offer in that regard. And one of the things that we had as a mission is really to try to help those who I would share are not typically a part of these conversations, communities and those that are serving and representing communities that are often not a part of this professionalization conversations that we've been having over the last few sessions. And so those of us that are in rural areas, Appalachian areas, urban areas, who sometimes are not able and have not had the access to this kind of support and training is really behind some of the intent that we had. And so I share that, saying that we are intentional about that and hope that you could help us in that regard as well. Those that are within your sphere of influence and contact that you know are looking to be a part of this great field that we are all representative of, to be able to help to make sure that we are kind of paving that path for helping to make sure that we're able to get more and more and more into this conversation. And to those ends, I would just simply say thank you to each and every one of you for your commitment and your conviction in trying to make sure that we are doing this and doing this well. I want to extend my thanks again to Amber and Angelica and to all the team that have been a part of making sure that we're being able to coordinate this extraordinarily well. I'd also ask you all to consider what is it that you want to make sure that you get out of these sessions. There are a small group, a subsection of you all that are also participating in additional, what we refer to as study halls in this conversation of change that allows us to go even deeper into the same content areas and the like. And I believe that those have been very, very beneficial. I know that they've been enjoyable for those of us who have been a part of helping to administer them. I simply share with you that if you think your state would be interested in that kind or that level of support, and you happen to fall within the 8 states that we serve at the Southeast PTTC, to reach out to us, to inquire about this for and on behalf of your state, and we could look forward to seeing how we might be able to support you in that regard. But with all of those things being stated, I will offer one little caveat to what my dear friend Amber offered. I think ethics is one of the most exciting things to engage in. I have a great amount of fun with respect to the ethics trainings that we are a part of and associated with. And to help us to do that and to do that well, she doesn't need any further introduction. If you've been with us for the last few weeks, you already know how much of a dynamo she is. She is my dear friend, Dorothy Chaney. Dorothy, thank you so much for helping to organize this content for us, and I look forward to engaging. Those, one more request, if you have questions, if you have comments, if you have thoughts, we are asking you to put those into the chat. We'll be monitoring the chat. We'll be engaging in having a conversation with you via the chat during the session as well. Make sure you get out of the session what you need to get out of it. And Dorothy, the floor is now yours.
Awesome. So excited. I've been watching folks log on, and there's a lot of you that have been on one or both of the previous sessions. So if this is your first session, welcome. If this is your second or third session, welcome back. These are just fantastic hours and a half let me just, before I bring up the slides, sort of talk a little bit about how we approach this. So yes, we're getting ready to write the CPS exam. But the CPS exam is really a way to illustrate the knowledge that you have to inform the work that you're doing in your communities. So as we identify the domains, we're going to talk about what does that domain mean, have some good conversation about it, and then we will do some practice questions. And this is really designed to complement the resources that are available on the Southeast PTTC website and other resources to get ready for the test. So this is a chance. What I love, Carlton, is my favorite things are when we can bring together a cross section of folks that are working in the field and have really good conversations. And I agree, if you don't like ethics, you're not doing it well. But let me tell you, the first time I trained ethics, I walked away from that going, I think I might have questionable ethics myself. And so here's the thing. I love going through ethics because it gives us a chance to step back and reflect on the kinds of decisions that we're making on the fly on a day-to-day basis. So today when we get to talk about that, we'll talk about a few scenarios and we'll talk about how ethics really is the underpinning of all the work that we do, because it informs how we approach absolutely everything from capacity building to planning to data collection, all of it. So let us begin. There are no breakouts. Let me just see where I'm sharing here. There are no breakout sessions for those of you who have been on the sessions with us. We tried breakouts, but it was just, oh, perfect. It was just a little bit lumpy. So we do have no breakout sessions. Let me also say this group isn't shy to share. So we love that. And sometimes Carlton and I are not going to be able to keep up with all, because there's 177 of us on the call. So you may have to put a comment in a couple of times, but we will try to get to all of them because that's what makes these sessions rich and full. So what we're really going to talk about today is we're going to describe individual and environmental strategies. We're going to explain the importance of comprehensive strategies and effective prevention efforts. And embedded in that is really the discussion about environmental strategies as a strategy towards sustainability. And we're also going to define ethical principles and responsibilities central to prevention practice and the Certified Prevention Specialist Code of Ethics. Excuse me. So here's just the slide that we've showed you for each of the sessions. This is the 6 CPS domains and exam weights. There are lots of resources on the Southeast PTTC website and resources available through the Southeast PTTC as you're getting ready for the CPS exam. And don't be scared of it, because what I've seen from this group on the first 2 sessions is this stuff. Yeah, 100 years ago, I don't know, 100 years ago, I was a flight attendant. And that's how I actually got into training, Carlton. And so I was a flight attendant trainer. And so we used to have to do these in-flight checks. So the flight crew could be going to London, and all of a sudden, Dorothy Cormier at the time would show up with her briefcase and say, "Hi, I'm here to do a flight check for you today." And what that was we were checking in to make sure they knew the rules, the regulations, the procedures. And people used to get really nervous, and I would say, no, don't be scared. This is an opportunity to show me how much you know. Exactly. This is an opportunity to shine. And I always think about that when I look at a training lens, is don't be afraid of the CPS exam. You folks have illustrated to us over the last 2 sessions, you know this stuff. This CPS exam is an opportunity for you to really shine because you know this stuff. It's just how do you frame it so that you're answering the questions. And I just want to set the stage with this because you all have a deep, deep knowledge, and you've reflected that over the first 2 sessions. And yes, I still know my flight attendant announcements in English and French. So our objective today is we just did the introductions and objectives. We're going to do domain 5 and domain 6. So you know the recipe if you've been on this before. We do an overview of the content in the domain, and then we do some sample questions. With ethics, we look at it a little bit differently, but we'll get to that when we get to that. So domain 5 is, and I gotta say, every time I've been prepping for these sessions, Each domain I go into, I'm like, oh, this is my favorite domain. Then I go to the next domain, I'm like, oh no, this is my favorite domain. I gotta say, I really think domain 5 and domain 6 really are my favorite domains. Public policy and environmental change. That's what it's all about with us being effective as preventionists. So what we're going to talk about is how do we look at evidence-based environmental strategies and policies, thinking about education of decision makers, because that's part of that. That's covered in this domain. Also covered in this domain is for you to demonstrate advocacy skills in public health promotion and prevention. So political processes, the differences between lobbying and advocacy, public policy development and advocacy, change agents and policymakers, negotiations, and then that social justice element that is so important in all of the aspects of the work. Now, let me say, as we only have an hour and a half, and these are pretty big domains, we're going to pick out pieces of the domains for us to talk about and to discuss. We can't go into each one of these bullet points, but as you're preparing, these will be the pieces that you'll be doing a deep dive in as you're getting ready for the exam. So when we look at domain 6, we're thinking about adherence to legal, professional, and ethical principles, ethics. How we think about cultural responsiveness and health equity in prevention, again, through an ethical lens. We want to also make sure that we're talking about healthy behaviors in self-care, the importance of participation in professional associations, and demonstrate the knowledge of the science of substance use and misuse. So those are the pieces that are in domain 6. So let's get started. So let's take a look at public policy and environmental change. And again, there's a lot within this domain. We've picked out some of the pieces to really dive into. Now, as we're starting the discussion of environmental strategies, I want you to think and just hold that thought. If your dog had fleas, what would you do? So let me tell you, I have 3 dogs and 3 cats. Fleas, thankfully, don't often come into my house. Carlton, they never come into my house through the cats. Why? Because 2 of my cats are hairless. So there are no fleas to be found on those naked bodies, let me tell you. So if your dog had fleas, what would you do? Think about that as we dive into environmental strategies. So public policy and environmental change, thinking about evidence-based environmental strategies, those education of decision makers, and to demonstrate advocacy skills in public health promotion and prevention. That's what's really framing the day. You're already starting to jump into strategies for those fleas. We must have some dog lovers or owners in there. Elias, I love that. Okay, Elias just won the day. Elias just said, I would first freak out and then probably look to get some help. Perfect. Okay. So let's look at the public health model. So the public health model is also known as the epidemiological triangle. What does that mean? It means that to be effective in our work, we have to look at the agent, the host, and the environment. And as preventionists, we need to implement strategies that are going to impact all 3. So thinking about the dog would be the host. The agent is the fleas. So if we're thinking about substance use, the agent would be underage drinking, the host would be 16-year-old Dorothy. But in this case, we're talking about Charlie. Charlie the dog is the host, the agent of the fleas. The environment is he went outside in the yard and he got the fleas. So what could we do to address the situation of Charlie the dog having fleas when he went out into the yard? What would be some strategies? All right, so I know some people already start. We're going to treat the lawn and the dogs. Debbie says we're first going to give them a bath with Dawn dish soap. It's proven to kill fleas. Then I would go to the vet and get medication. So we're going to take care of that dog. We're going to treat them. Claudia says we're going to treat them and figure out where he got them. Yes, that's going to be part of our assessment. Assess what's causing the fleas. We're going to freak out. Love that, Elias. We're going to treat the dog. So we're going to treat the dog. We're going to treat the lawn. We are going to wash them with Dawn. All of that. We're going to treat the house. Okay. Ashley says, yes, all of that. I have no idea how to take care of a dog. Okay, that's a perfect answer. That's right. Treat the itchy spots, spray the area. What you guys have just described is the agent, the host, and the environment. You've described strategies to treat the dog. We're going to give the dog a bath and Dawn. We're going to treat the bedding. We're going to treat the yard. We're going to treat the house. Guess what we've just done? We've done strategies to address the host. We have strategies to mitigate the agent, and we have strategies to change the environment. And that's the public health approach, is that we don't want to just treat the dog, because what if the dog goes back out into the yard after we've given him a bath with Dawn? What's going to happen? He's going to pick the fleas back up again. So let's think about this through the lens of underage drinking. So in my community, there is a lot of underage drinking, and I'm special, but I'm not unique. There's a lot of underage drinking in all of our communities. And so we might do really important strategies. We might be building resiliency skills, and we might do great health curriculum and life skills and after school programs. And all of those things are going to create healthy youth, right? But if we don't treat the environment, if we don't change the fact that kids are stealing alcohol from their own liquor cabinet, or they're able to get alcohol from a retailer without an ID, guess what happens? All of those strategies to create healthy youth are great, but they're limited because we know that adolescents' brains aren't completely developed yet, and they may go out and they may make some questionable choices, and they may steal from the liquor cabinet or go into that liquor store and buy alcohol without an ID. The idea of understanding the importance of environmental strategies is we want to create an environment where the easy choice is the healthy choice. The easy choice is the healthy choice. So that's why the environment is so important. We want to look at the host, the agent, and the environment. In our very first session, we talked about how do we do this? Well, we do it through the strategic prevention framework by starting with an assessment, by understanding what the agent is that's happening, by understanding who's the host, who's being impacted by the problem, and then we identify strategies to address all three: the agent, the host, and the environment. So just like Charlie has fleas, we need to look at all of those elements when we're looking at our work. So let's take a look at another substance use. So cocaine is being sold at a neighborhood bar. Thinking about the agent, the host, and the environment, what are some strategies that we can do so that we can change this situation of cocaine being sold at a neighborhood bar? Alert the authorities, right? So that would be an environment. Close the bar. We could close down the bar. What else can we do? Report the incident, increase police presence. We're going to educate. Yes, we're going to educate the owner. So we're going to increase the police presence. That's an environmental strategy. We could close the bar. That's an environmental strategy. But we're also going to talk to our kids. We're also going to educate the bar owner. We're going to conduct Narcan trainings. So we're looking at all three. We're looking at the agent, the host, and the environment. That is increased security measures. That's the public health approach. And that really sets the stage for understanding environmental strategies. So when we're thinking about prevention strategies, and let me just say, this is why certified prevention specialists who are experts in this field are so important at the community level, is that we often see that communities come together to address a problem, and they really focus on those individual strategies, and they shy away from those environmental strategies. But we know that comprehensive behavior change requires both individual and environment. So when we're thinking about individual strategies, it's targeting knowledge, it's targeting attitudes around specific groups of people. When we're looking at the environment, we're thinking about that broader context. How do we create an environment where the easy choice is the healthy choice? So if we increase cameras to find out who the drugs are coming from, and we increase police presence, then guess what? If I'm someone that wants to experiment with cocaine, but it's no longer available in the bar, guess what? If I can't get it, I can't use it. I've created an environment where the easy choice is the healthy choice. So we want to also do that education awareness. So it's really important for us as preventionists to understand it's not an either or, it's an and. We need to do individual strategies and environmental strategies. Collectively, we create that population level behavior change, which we know is so important in addressing substance use. So let's talk a little bit about comprehensive behavior change strategies and how it's important to include both. So if we were, and this is an example, if we were living in a neighborhood where folks were speeding past our yard every day and there were children playing in our front yard, what would be some strategies that we might employ both individually and environmentally to change that that local condition of people speeding through our neighborhood and putting our speed bumps? So that's going to change the environment. What else? Signs, that's going to be education and awareness. Speed traps, change the lots, and environmental strategy. Stop signs is going to be individual strategy. Ask the police for help, that's going to be change the consequences. You guys got it. Fence the yard, I love that. All of those, and here's the beautiful thing about looking at comprehensive strategies. Not just one of those strategies is going to ensure the behavior change. It's the connection and the collaboration and the combination of all of those strategies that is going to get that effective long-term change. So when we think about sustainability, comprehensive behavior change incorporating both individual and environmental strategies is at the heart of sustainability. So some examples of individual strategies we'll look at, but let's explore how we define them. So individual strategies tend to focus on single strategies. They're provided to groups or individuals, like a curriculum or education and awareness. And so thinking about classes or activities, we're looking at changing the knowledge, attitudes, and skills within that population of focus. And many times when we're looking through the lens of prevention, our population of focus is youth. So some examples of individual strategies are the good behavior game. That would be an individual strategy that we would see within the school setting or domain. Life skills training is an evidence-based curriculum that is an individual strategy that can be offered in either the school or the community setting or domain. Sources of strength, Marianne, that is another individual strategy that addresses behaviors, knowledge, and awareness. Strengthening families is a family domain. And then mentoring programs could be programs that exist at the community level. What are some other examples of individual strategies that you work on? So sources of strength is a good one. What are some other examples of individual strategies? You can either unmute and share, or you can put in the chat box. Would love to hear. What are some individual strategies that you work on in your coalition, in your community, in your work?
Hello.
Yes, hello.
Hi, this is Ashley Daniel. One of the things that my coalition we do is one of our coalition members is a part of a therapy collective called the Progress Place here in Metro Atlanta, and we he does paint therapy with the
Love it.
kids.
Wow.
Love it.
hmm They do paint therapy, and then they talk about therapy through a lens of hip hop, through the lens of hip hop.
Love
Yeah,
that.
it is a really cool, and the kids get really involved. And our only issue is like he only has so much time, and the kids are like, no, why can't we keep going? But it's an amazing thing.
Love that. I love that. That's a
Mhm.
really good example of an innovative and engaging individual strategy. So that's fantastic. So some of the others, so youth leadership programs, another like meaningful roles for youth. Two, life skills training, Too Good for Drugs, Red Ribbon Week activities, support groups, community outreach. You guys got this. Mentoring programs, community sports, love it. Community resiliency models, love that. So building protective factors, youth advisory boards, Catch My Breath, Project Connect. All of those are beautiful examples of individual strategies. Those individual strategies can happen at the school level, they can happen at the community level, they can happen within the family level. So all of those strategies are critically important. When we think about that epidemiological triangle, these are strategies that are going to create healthy hosts. That's an individual strategy that are designed to create healthy hosts. So let's take a look now at those environmental focused strategies. So these are things like, so are individual strategies basically programs? Yes, and strategies that are designed to create behavior change. So it could be education and awareness. It could be an evidence-based program. It could be an alternative activity. It could be youth engagement activities. Think about building the skills of individuals. So it's programs and activities and alternative activities that are designed to like build resiliency, positive health promotion, professional development, personal development. Those are individual strategies. So it's programs plus. Environmental strategies. Think about policy change. Think about procedures, systems, norms, creating that environment where the easy choice is the healthy choice. So it's really looking at the environment within your community. And this, when I do coalition trainings, this is where we have really meaningful conversations right off the get-go, because the unique role of a coalition is to really look at those shared environments, the environmental strategies, because our agency partners are doing the programs, are doing the alternative activities, and certainly many coalitions are doing it too, but who's looking at what's happening in the environment, those policy systems? That's where a collective coalition comes together and says, what's happening in our environment? So environmental strategies have a greater reach in the community. They're longer in duration. So think about sustainability. If we pass a policy, we have locked in sustainability to that behavior change through that policy. That's why policy and sustainability, environmental strategies and sustainability come right hand in hand. So there's some really great examples in the chat box of environmental strategies, and I'll come back to them in just a minute. The other thing about environmental strategies is we can see really fast results with environmental strategies. So we can get quick wins, they're longer in duration, and think about, we often talk about your community's denominator. So if we can think about what are some strategies that we can employ and implement to change the entire community. So things like smoke-free laws, alcohol outlet density, policies and laws are really good examples of how in one fell swoop, we can change and have a greater impact on the community. Now remember, it's not an either or with individual and environmental strategies, it's an and. The unique role of coalitions is to really look at these environmental strategies. So some examples of environmental strategies are restricting alcohol at community events. That would be an example of a policy. I'm going to go right to the chat box because there's some really, really good examples in here. I'm going to scroll up. So Carlton has been, yes, so non-alternative opioids for pain management, absolutely. Having a policy to have students carry naloxone, having naloxone available at libraries and locking that in with a memorandum of understanding or a policy, that's an environmental strategy. Sticker shock campaigns can be an environmental strategy, especially if we match it with things like alcohol age compliance checks, or if we're targeting social hosting, social host ordinances. Mara said your coalition worked to write and pass county merchant training ordinances. Yes, to require merchants who fail compliance checks to require in-person training. Those are beautiful examples of environmental strategies. Changing the blood alcohol level for operating a motor vehicle. I know there's some states like Utah are at 0.05. Hawaii is moving towards 0.05. Those are powerful environmental strategies. Benches at a park with the red line and the 988 number, so it's changing the physical design of the environment. Post around the school and community. That can be either an individual and or an environmental strategy by educating individuals and also changing the physical design. Submitting public comments for city ordinances. You guys are getting this. Bulletin boards, PSA on radio, that's going to really lean towards an environmental strategy. It depends if we're working to maybe the PSAs to pass an ordinance, that could lean us toward an environmental strategy. You guys get this. Marijuana dispensary licenses. It's not either or, it's and. We need both. We need all of that. Looking at permits for alcohol at cities events, that's a system change. Enforcement for school policies. Take back programs, that's an example of an environmental community-based process. Public awareness campaigns. Now, public awareness campaigns are an interesting one because some states, depending on the funding streams, really look at public awareness campaigns as an environmental strategy. Others look at it as an individual strategy. It really toggles that line of both. So other examples in here, beautiful. Anybody want to unmute and share any examples of environmental strategies that they are actively working on in addition to the ones that were put in the chat box? Would love to hear from you.
I'll jump in.
Thank you, Monica.
Oh,
Astrid. No, thank you, Astrid. Then I'll go to Monica.
Oh, you want Monica first? Go for it.
No, Astrid, you're first. Sorry.
Okay. Alphabetical. Okay. So the one thing I was just about to drop in is that for Drug Take Back Day, we were doing some education with elders around safer, drug interactions, how to, we're no longer flushing drugs down the toilet anymore, et cetera, et cetera. And it really came very clear to us to understand, well, as the stories came out from the elders, they were saying, my neighbor across the hallway, she hoards stuff just in case.
Yeah.
And we realized, okay. And now we also know that a lot of those elder folks, they might not be able to get to the police station or the fire station on the Saturday on Drug Take Back Day. So what I suggested, we were able to work out with the police and with the folks that are there on staff we have several elder housing communities in our town. And what we were able to do is bring the Drug Take Back box to the community where the elders are living and have that box available for an entire day. And folks just had to bring downstairs their unwanted drugs. And we were able to collect about 20 to 25 pounds from just one setting alone. And, that's almost half of what we were collecting from the town total. So if you're, it really is amazing how well it worked. So anyway, we've done it now 2 times, and it's going to be a thing we do every time. And I really suggest it's a great way to get some of those drugs out of those cupboards.
Beautiful.
I love that. And you know what I love? So thank you, Monica. I'm going to come to you because I saw your hand was up. I just want to comment on Astrid. I got excited when you were talking because this is what prevention specialists do. We don't just stop at doing one strategy. We use the strategic prevention framework and gather more information and say, how do we go deeper into this strategy so we get further reach into the community? And that's exactly what you did. The DEA take back events or the take back events, those are great. Those are environmental strategies. But who is being missed through this strategy? And how do we go deeper into the strategy and expand our impact? I love that is what excites me about this field, because you used the strategic prevention framework. You gathered more information. You didn't just stop and say, hey, right, we did a great DEA take back event. How do we go deeper and get a deeper reach in the community and expand those environmental strategies? I love that. That's beautiful.
And the one thing is no one in the room said, we really wish we had Drug Take Back Day boxes here because we need to get rid of them. Because the idea of hoarding, right? And these folks grew up probably with parents or themselves during the post-depression, so holding on. So it's not only let's help you get this stuff out of the cupboard, but what we're able to do is to talk to them about this idea of hoarding and the idea of, if you're not a medical person, to give your buddy something that you've had in your cupboard for a while, you don't know what else they're taking. So we're also able to educate them about, the world is different now. We don't flush the stuff down the toilet anymore. And there's this and this and this to know. And we're really encouraging them to speak to their doctors, always referring them back to the professionals, of course, that they have. But the conversations around the box were the most valuable to them, because for them, it's just a few things out of their cupboard. But the knowledge they left with, the conversations they had post-visit, that's the gold right there.
I love it. I love it. And the gold is you describe the public health approach. You talk about individual strategies and environmental strategies. Love that. Love it. I see also a lot of really, really good comments in the chat box. Monica, I want to come to you and hear what you would like to share.
So we have Monica, we
Thank
have
you.
Xavier after Monica.
Thanks, Carlton.
Okay, thank you, Dorothy. We, the town I work in, were recipients of a STOP Act grant, and
Yep.
it ended the end of April, just by its natural ending. 4 years had been finished up. And one of the main objectives was to partner with the police in getting compliance checks more on the calendar 2-3 times a year. This has been a success, but what really I'd like to share is the letters of those sellers and servers of alcohol, those establishments that passed, received letters from our coalition stating that they passed.
Love that.
It's just they didn't know that there was a compliance check that day. They would otherwise not know about it, but it's just nice to get a little pat on the back that you did the right thing when nobody was looking, and the community really appreciates it. And this isn't new to coalition work, but it's going to be sustained beyond the life of the grant that's now ended. So we like that one.
And I love that, Monica. So thank you for sharing. I love that story.
Welcome.
And what I love is that you started. Here's what I love about that story. Let me preface this by saying there's never enough funding. There's never enough time. And that's why these environmental strategies are so darned important in our work, because what you just described was, aside from the fact that the STOP Act came to its natural end, you had mobilized the community to implement environmental strategies, and they are going to be sustained past the grant because of the fact that you built community support for them. You illustrated their impact. Law enforcement bought in, and you did positive reinforcement. So the retailers are looking for that kudos, job well done for being a good community partner. I love that. I love that. Xavier, would love to hear from you. Thank you, Monica. Xavier, would love to hear from you.
Yes, how are y'all doing?
Great, man.
All right, one of the things that I would love to share is, as far as an environmental focus strategy and some examples, one of the things that we have done is we have taken our reach when it comes to getting back unused or over expired medication. One of the things that we are doing now, we're attacking the elderly community, because the elderly community, we're starting to find out, are the ones that are holding on to medications. So one of the things that we have established and that we're using, we call it the porch lock box drop. And what that consists of is us going to every home in the communities in our county based off the information received from the Commission on Aging, because at the Commission of Aging, that's where the elderly in the communities go to play bingo and eat meals. So we attack that by getting the addresses and going to them instead of dropping the boxes off at that location. So what that has done is that has extended into the whole county, us going to the porch with lock boxes, information, resources, and telling them the importance of locking up their medication as well as dropping it off then. So the Drug Task Force, the Coalition, law enforcement, which is under the county, the Sheriff Department, we'll go to these homes and we'll drop boxes off, explain to them. And then at the same time, what we would do is, after we do that, we'll come back, get more names in other cities in our county. It has been happening now for 3 years, and over 400 lock boxes have been served, and over 400 senior citizens have been served.
So I love that. Xavier, that you just again described beautiful environmental strategies of educating folks, but also changing the environment, of going to them, of breaking down that barrier of transportation. And I was just thinking, Carlton, I was thinking to myself, I was like, these people do not need us. These people, y'all don't need us for anything. Like y'all are teaching us. What I love is how many great ideas I'm seeing commented in the chat box. People are picking up really, really great ideas. I love that. I think that's one of the most valuable parts of us coming together. These are all beautiful examples, guys, of individual and environmental strategies. And you see how they blend together? We want to do those environmental strategies like Xavier just identified, of breaking down those barriers and going to folks that may not be able to make it to a take back event, but also educating them and changing the environment. So it's those individual and environmental strategies. And as we're thinking about it, we need to think about how do we look at it in the community domain, in the school domain, in the family domain, and then how do we lock those in with policy change? So
Dorothy,
yes, yes,
Dorothy,
yes,
if I could just chime in just for one moment.
please.
And thank you. And so I just wanted to point out there's a great many phenomenal examples that were in the chat. Thank you all for engaging in the chat as healthily as you are. Appreciate that. Nancy still has put in a great resource for folks to consider. So I just wanted to make sure that that wasn't missed. Hey, Nancy, great to see you here. And the last thing that I wanted to ask Dorothy, if you wouldn't mind, can you go back to the prior slide?
Oh my gosh. I'll try, Carlton. It's WebEx. I don't know if I can go back.
Oh wow. Okay. Okie dokie.
I can go forward. I don't know if I can go back.
Hey,
Okay.
Dorothy, you should be able to go back. Do you have the arrow key?
There we go. Is that the one
Okay.
you wanted, Carlton?
Yeah, that's the one I want. Thank you.
Okay.
Thank you.
Thank you, Amber, for saving me.
Thank you, Amber. I was going to thank the Lord. I was going to thank Amber. I was going to thank everybody. I just wanted folks, as this is a session with all of its intent to help prepare us for the certification test, I would share with you that this definition, this is not going to be shared. I'm not saying that it's going to be explicitly on the test, but understanding that when we're looking at environmental strategies, we're looking at these things. Does it address policies? Does it address procedures? Does it address system change or changing of norms or expectations or regulations? Understanding this, because when they give you kind of a listing of choices and asking you which of these are environmental strategies or which isn't, and that kind of thing, I just simply want to share with you the importance of really understanding what it is that they are actually looking for you to know. And so I just kind of wanted to kind of put a tag on this for folks and to help folks kind of understand this, as we've been talking about a great number of examples as well. That's it.
Thank you, Carlton. And now I know how to go back. So beautiful. Awesome. So here's where I'm going to use, Xavier, I'm going to use your example. So say you're going to be doing some outreach to older individuals who may not be able to access take back boxes. That's going to be an individual strategy if you're doing individual education and outreach. If you sign a memorandum of understanding with the Aging and Disability Resource Center, that's going to be codified and they're going to do that education on an ongoing basis to all of their clientele, that then becomes an environmental strategy. So think about, how do we codify strategies into policy so that we can actually change that shared environment? And so policies can either be big P or they can be little p. So big P policies are really easy. It just means that if you're looking at a policy that requires a decision by an elected body, so that could be your county board, that could be your city council, that could be your board of education, your school board, if they're elected. Those are going to be big P policies. Little p policies are going to be things like an agreement with an MOU, a memorandum of understanding with the Aging and Disability Resource Center to sustain those strategies. There could be, Monica, you talked about compliance checks. Maybe you write a memorandum of understanding with law enforcement that they're going to maintain doing those compliance checks past those stop back grant funding. That's an example of a small p policy. The city council doesn't need to pass a law. We know compliance checks are already part of the law, but we can do a small p policy to sustain them being conducted by law enforcement on an ongoing basis. So when we're thinking about policy-based environmental strategies, we can either have those big P policies that require an elected body to make a decision, or they can be small p policies that are really practice changes that are still codified in agreements, but they don't require a decision by an elected body. And let me tell you, both of these can be really, really impactful. So not everything has to be a big P policy. We can have really, really important and impactful small p policies as well. Those are examples of policy-based environmental strategies. So when we're thinking about comprehensive strategies, we also want to think through the lens of how are we really making sure that we're doing all of the strategies that we need to do so that we've got that comprehensive piece. And that brings us to the CSAP 6 strategies, which include information dissemination, prevention, education, and skill building, alternative activities, environmental strategies, and community-based processes. Those are all categories of strategies that will help ensure that we're doing both individual and environmental strategies. And of course, the 6th one is problem identification and referral. When we're thinking about evidence-based, they're evidence-based practices and programs, and they're evidence-based environmental strategies. What we mean by that is there's some science to show that they're effective. And so here's just an example of some resources that can help you identify effective evidence-based environmental strategies. There are all sorts of ways and resources that you can use. The Southeast PTTC is a great resource. There's also other federal agencies that have resources related to evidence-based environmental strategies as well as evidence-based programs, because we want to make sure that we're following the science to show what works. We also want to make sure that as we're looking for those evidence-based programs that we're looking for inclusion. So these are the main elements of the domain 5. And we just really touched on those environmental, evidence-based environmental strategies and the importance of individual and environmental strategies. It's a broad domain, and these are the pieces that we sort of embedded into our discussion. So let's move into some of our practice questions. So practice question number 1. A community coalition is advocating for an ordinance to ban the sale of alcohol at the annual Family Fall Festival. This is an example of A, an alternative activity, B, a family intervention strategy, C, an environmental strategy, or D, an enforcement strategy.
All right.
Seeing a whole bunch of C's. I can't fool this group at all. C, it's an example of an environmental strategy. So environmental strategies focus on changing community conditions. And so advocating for a ban on the sale of alcohol is a beautiful example of an environmental strategy, changing the environment. Question 2, an example of an evidence-based environmental approach to substance misuse prevention is A, school-based curriculum highlighting community risks, server intervention training, C, programs serving student dropouts, D, community health fairs. An example of an evidence-based environmental strategy.
I have a couple of A's, some B's. A's and B's are going, A's and B's.
And in this case, the example is a B. The B's have it. Server intervention training, like responsible beverage server training, is really a classic environmental strategy because we're aiming to change the context and conditions.
And can I just put a pause right there?
Please.
This is an example of what I was sharing earlier when I said for us to really be kind of lock in that definition that Dorothy offered. Environmental strategies meet certain criteria, right? Does it affect policy? Is it something that changes conditions? Whereas individual-based strategies, even if it's trying to change a bunch of individuals, you're looking at changes in knowledge and changes in skills that you're trying to do, right? So school-based curriculum would really fall under that because it's really about changing the individual's behavior or knowledge or skills, whereas server intervention training is really changing a condition that's happening. So that's, I just wanted to kind of put a point there.
And I just want to underscore that. I want to say that's one of the things that I really had to learn is sometimes when I was first starting the field, I got a little bit confused about evidence-based, because evidence-based can be a program, but evidence-based can also be an environmental strategy that's proven to be effective. So we need to differentiate between evidence-based program. That school-based curriculum is probably an evidence-based program. When we're looking at evidence-based environmental approaches, we're looking at what Carlton just explained. Love it. Thank you, Ashley. Question 3, there was an underage drinking problem in the community. Enforcement of minimum purchase age laws against selling alcohol and tobacco to minors through the use of undercover buying operations was utilized to address the underage drinking problem. What type of prevention strategy was used? Alternatives to drug use, B, dissemination of information, C, prevention education, D, environmental approach.
I would want somebody to say, why is it D? If they're choosing D.
Love that. Why is it D if you're choosing D? Policy change. Yeah, we're looking at environmental change. Was this because it's a problem in the community? Yes, we're changing the community context by focusing on enforcement of underage drinking laws. This is a good one because guess what? An environmental strategy doesn't always mean that we have to pass a law. Minimum age laws already exist. It's the implementation or enforcement of that law is still an environmental strategy. So it's policy enforcement. Beautiful. Yep. So here we go. It's an environmental approach. We just answered that. All right. Question 4. A local coalition advocates for the enforcement of social host law, penalizing adults who host gatherings where underage drinking occurs, even if they don't provide the alcohol. Which strategy does this represent? A, prevention education, B, alternative activity, C, environmental strategy, D, family intervention. Social host law.
You got a flurry of C's coming
It's the
through.
C's. Think about that, guys. So C, thinking about, and that's why I bolded it, the social host law, environmental strategy. That's it. All right. A county passes an ordinance increasing the minimum price of alcoholic beverages. As a result, bars must charge at least $2 more per drink. What is this an example of? Enforcement, supply side economic intervention, information dissemination, or community-based prevention education?
Hey, a little bit of variety on this one. I got some A's, I got some B's, I got some D's, I got some C's.
This, y'all
I
asked
got
for
a B
harder
with a
questions.
question mark.
Y'all asked for harder questions. So the answer to this one is B, supply side economic intervention. And I pulled this one out because I saw questions related to this on a few practice exams.
Right.
So this is, and I really had to think about this one myself. So what I did for this one, because when I went through it, is I went through each one and then read the narrative again and said, A, does it fit enforcement best? When I saw that supplied side economic intervention, I was like, that feels like it fits the best. So that's a bit of a harder question that I pulled from some prevention what does it mean? It means that there is some science showing that if we raise the price of alcohol, we'll see a correlation in reduction in use. And so that's what they refer to as supply side economic intervention. It's an evidence-based environmental strategy. All right. We are going into the next piece, and we talked about these are what we're going to be looking at in these key concepts. All right, so Carlton, this one's for you. You are agents Jane Doe and Kurt Weller. There's a bomb set to go off in a crowded building in 5 minutes. The terrorist who set the bomb and has the deactivation code is handcuffed to a chair in front of you. What do you do? What do you do? You can either put it in the chat box, ask nicely. All right, good luck with that, Eric. Love it. You're going to ask nightly. Call clear the building. Run. Run. All right, so Mary and Alyssa and a few others are not really worried about everyone in the building. They're just going to run. I love it. Call the PD and run. Love it. Alert as many people around you as possible and run. Clear the building. Do you think you're going to be able to do that?
Instead. I need a good cooking show.
Ask Xavier to pray. Okay, I love that one. The bomb squad. We only have 5 minutes. What are we going to do? So I was using this scenario one time and someone said, Dorothy, it's going to be easy. I've got 5 minutes. I'm going to break his knees because I need the code. And you know, that's an honest answer. Are we going to be able to uncuff the terrorists? Guys, we've got 5 minutes. We're going to ask nicely. We're going to call them. We got 5 minutes to clear a crowded building. Do you think we're going to be able to unleash Jane on them? Okay, I love that. Okay, love it. So the thing is, pull the fire alarm. That's awesome. So anybody want to pray hard and just hope that we get an immediate response? Elias, I love this. I was honestly thinking about torture the code out of them. See, I love a little bit of honesty in this, right? So what is it that we can do to change this outcome? But what are the decisions that we can make to actually address this issue that we got 5 minutes and we got a crowded building and there's a bomb that's going to go off? Really, this is a great way for us to sort of collaborate and I love all your really nice, polite answers, but I'm going to say in 5 minutes, I'm probably going for the break the knees, or at least I'm going to run that one up the flagpole. I got to be honest. I'm going to run that one up the flagpole because I need to get out of the building and I don't want the bomb to go off.
Dorothy, forgive me. I just feel the need to express at this point, the views and opinions expressed by the instructor of this training are not necessarily held by SAMHSA or the Southeast PTTC at any point.
I love it. Hey, Carlton, I just said I was going to run it up the flagpole. I wasn't going to necessarily do it.
Dorothy's breaking some knees. I just need to make sure we are clear. We are not advocating on behalf of breaking knees.
And that's what I love about talking about ethics. I love talking about ethics.
Yes, indeed.
So why is ethics in prevention important for us? Yeah, we don't want to just go around breaking knees, but it might get us to the result that we need. Why is ethics so important in our work? You can either okay, enough with I know, it helps guide our decisions. That's just it. And I love that, Scott. That's right, Eric. You're not confident that breaking knees is ethical, right? I made an unethical decision, right? So that's right. It's about building trust. It's about limiting harms. It's about understanding that our decisions may have consequences and that at the heart of the work that we do, we have to be ethical, do no harm, all of that. I'm not going to break anybody's knees. Just ran that one up the flagpole. It's just an example. I love that, the ripple effect. This is why I love talking about ethics. And I love having those scenarios where in a safe environment, we can talk about what are the implications of my actions if I do decision A or I do decision B. And we make these decisions on the fly, absolutely every day in our work. And it's so important that we take a minute to think about what are our values, what are our principles, and how does that implement or impact the ethics that we apply to the work that we do every day. So values are deeply held ideals, principles are those moral values, and ethics are those codes of conduct, those agreed upon behaviors that really guide our path. And now the slides are going on their own. When you're looking through the prevention code of ethics, there are 6 principles. And when you go through the ethics training that you have to go through regularly as part of your CPS certification, we look at the 6 principles: non-discrimination, competence, integrity, the nature of services, confidentiality, and then ethical obligations for community and society. And I'm just going to come back to the chart because there's so much good. After the knee discussion, there was a lot of really good comments in the chat box. But I love you, Eric. I was like, I'm not confident that breaking knees is ethical. So, because you're right, it wasn't. That was an example of me throwing my ethics out the window in the last 5 minutes, right? We wanted, I love this, to create a certain standard. It builds trust to limit harms against individuals. It can help us build rapport and maintain trust because you have to make sure the thing you're doing does no harm. And Claudia, you also said that at the same time. The ripple effect, that's right, because our decisions have really deep impact and ripples in the community. And yes, and those 6 principles that comprise the code of ethics really are those common set of ethics and standards that guide our decision making. And why I really love doing these ethics discussions regularly is The reality is that day to day, there's decisions that we could go either way. And so
Right.
what we have to do is we have to look at, can I live with the impact of my decisions? Can I run up the flagpole, the impact of these decisions that I make? And do I have a credible process, this code of ethics that I can use to make these decisions on a day-to-day basis? So here's another example. The coalition is conducting a community assessment. A volunteer on the coalition is assigned to do a social media environmental scan. During the scan, the coalition member has found pictures of underage drinking parties that identify youth who are children of 2 other coalition members, active members of the coalition's youth council, not on the coalition, but are members of the high school football team and in violation of the school's substance abuse policy. What should the coalition do? And what principles are impacted on that? I'll go back 1 slide so we can look at those standards. Integrity, confidentiality, ethical obligations. So the coalition is conducting a community assessment, and one of the volunteers in the social media scan sees kids that have been underage drinking parties. What would you say? So those are the principles that are impacted. What should the coalition do on this?
So we have a few things coming in now: confidentiality, ethical obligations, integrity. Everybody is getting an everybody's getting an email. Integrity, confidentiality, ethical obligations are kind of seem to be some of the themes.
I love that. So, so I want to think about, I love that. Thank you for that example. Everybody getting an email and confidentiality. How might be, and think about, we also probably have members of the school on the coalition, and they have a substance use policy, and they probably have some confidentiality. I'm thinking about what are these ethical considerations? I'm going to come up with lots of good stuff. Social media is public knowledge, so there's no confidentiality. That's a good point. Well, so from the confidentiality standpoint, that's really good. I'm also going to throw in there, integrity. And, do we want to shoot everyone an email? That's one option. Is that the best option? Do we want to reach out to the school? Address the person who posted the pictures? If the volunteer is a certified prevention specialist, they should find someone who is and ask for their advice, or a supervisor. I love that. Ask for advice and walk through the decision-making model. Talk to the parent. Maybe they have no clue about their teens partying. To the coach, do a display. Talk about securing alcohol. Contact the coalition partners at the school district. Speak with the CEO of the coalition ASAP. Nature of services. What are we talking about with the nature of services? Well, this is really what we're talking about with the nature of services, is that we want to make sure that when we're implementing our strategies, we're doing no harm. Right. And that's really what we're talking about. So, Eric, you said those emails were all individual, not a mass email. So here's the thing. Each one of you made decisions based on looking at those criteria of the code of ethics. And that's really important. The idea is that there is no one decision to make. It's about, do we make a decision looking at those code of ethics and really analyzing, are we adhering to the code of ethics as a certified prevention specialist? And if we can say yes to adhering to that code of ethics, we're making a decision that we can live with because we've used a credible code of ethic to guide our decision. And so that's what really ethics is about there are different scenarios and different answers. What is the decision-making process that we use, keeping in contact and in context those code of ethics?
Dorothy, if I could just add to that,
Please.
you might be getting into it. One of the things that I think about, and you've shared this in one way, is that most of the situations that we're going to encounter in our profession is neither a clearly black or white issue. It is in the gray. And most of the things that we are going to be encountering happen in what we refer to as the gray areas, which is why we need to have a code. What this whole portion of the certification process is really all about, and the reasons why we are required to go through ethics training on an ongoing basis and recertify with respect to that, is because it's not about identifying every right answer versus every wrong answer. More importantly, it's about our being able to become experts in the process of how we make the decision. That's what Dorothy is really getting us into and helping us to understand. So having clarity around, I don't have to be an expert in every specific circumstance and situation. What I do need to become an expert in is this ethical decision-making process that we are in, or that we're getting to share with you.
Yeah, and what I love it when you dive into your ongoing ethics training, you'll have lots of opportunity to practice the model. And what I love about that, Carlton, is, most of us are making these decisions and we don't have time to pull out a piece of paper and jot down all of the different elements. It's about really understanding and internalizing how we make these decisions, incorporating those steps so that we can make the most ethical decision based on the scenario. That's right. We also, and at the heart of this too is, and a lot of you said the do no harm piece, is we want to also incorporate cultural responsiveness and health equity into our prevention processes. And this is really the continuum of cultural competence, from really being culturally destructive and not recognizing the uniqueness of cultures and races and communities, and building our way up so that we achieve a level of understanding and really incorporating that cultural responsiveness into our work, which is really at the heart of ethics as well. The other piece that's really important as we're making these decisions on a day-to-day basis, thinking about ethics, is equity. And I'm sure you've all seen versions of this diagram where the reality is that not everyone is being impacted by an issue at the same rate as others. There's disparities at this in the community. We move towards equality, which is we think that we give everyone the same thing and we should land at the same place. But the reality is that we're not all starting from the same place. So if we give everyone the same thing, like this equality, we still haven't got folks that are at the same place. Equity is where we're moving towards, where we understand that everyone needs to get the support that they need to produce equity. But ultimately, we want to really move towards social justice, where all barriers are removed from all people. And so everyone has equal access, and we have that social justice. And these pieces are really important as well as we're thinking about ethics, because this is going to incorporate the decisions that we make on a day-to-day basis. Callie, I love that, right? No justice, no peace. Cultural humility. I love that, Astrid. Can we expect cultural competence? I think about lifelong learning. Cultural competence almost implies that we've arrived at some level of competence, but you're right. I really like it, looking at it as cultural humility. I love that, Astrid. I'm not even an expert in my own culture. It is really time to really adapt that language. Competence really implies that we've arrived. It really is a lifelong learning situation. Love it.
Astrid, I'll only say that we're 100 and 1,000% in agreement with the statement. Also wanting to make sure that we're dealing with the certification process and what may be on these examinations and the like, and the language may still need to evolve a bit. And I think some of it has, and I think it continues to evolve as we continue to move forward.
Carlton, I think that's a brilliant really point to make, is that yes, our language is evolving. We need to make sure that we're using the language that's being reflected on the exam. Love that. All right, so let's look at another scenario. A local prevention provider was recently funded to provide parenting resources in the Alberta neighborhood, a racially and ethnically diverse community, which experiences unemployment, poverty, crime, gang involvement, and drug trafficking. The provider staff, Amy and Pat, have extensive parenting experience, but limited experience in working in that Alberta neighborhood, and are neither ethnically or racially representative of the community. The provider wants to be culturally responsive. What should the organization do? And I want to, as I throw this out, really underscore what Carlton said, is the reason why we look at ethics is because we often make decisions in the gray area. That's where this becomes so important as we think about the decisions that we're making. So the provider wants to be culturally responsive. What should the organization do in this scenario? Thoughts on that? If you want to unmute, that would be great. Or love that.
Talk to community leaders to help them find people that can represent the program.
Love that. Love that. Get community feedback, offer immersion opportunities, partner with community leaders or other organizations, talk to the community members about what they need and help with the cultural differences. Ask the members of the neighborhood to join the coalition for input. Love that. Bring them to the table.
Like the student standing, like as far as
Lisa, can you mute? Thank you.
So what I love about this, Carlton, you're going to ask some more information, Mark says, to get more insight. What would be appropriate for the community? Bring in the members of the community that are leaders. Create a steering committee with community members. Attend some sensitivity trainings. That would be great as well. Yes. What I love about this is Astrid says, all right, people should listen with their hearts and be non-judgmental. Amen, Patty. Recruit folks either from the community to train or recruit another to hire who does. I love that. Nothing about us without us. Nobody said, well, you know what? They've got good intentions, go in and do the curriculum. That's bringing community representatives. That's just it. So thinking about in our day-to-day work, you know, and sometimes we've got funding that needs to be spent by the end of the month. We don't have anyone trained that is from the community, you know, and sometimes we rush into it without thinking about these cultural and ethical elements of the work. And this is so important. I'll give you a quick example. I was working in a really urban community a few years ago, and they did a DEA Take Back event. And in this community, it was extremely diverse. And there was a large immigrant population. And so this coalition did a DEA Take Back event, Carlton, in the local precinct with a uniformed officer at the DEA Take Back event. And guess what happened? A whole lot of nothing. Nobody showed up to the DEA Take Back event because you know what they did? They had really good intentions. They rushed into the strategy. They did it all right, except they did it all wrong because they didn't engage the community. And so they ended up meeting with the community. They retooled the whole thing. They engaged the community. They offered it at a CVS or a Walgreens, I forget, with an officer who was in plain clothes, who looked like the people in the community, and they had a really successful event. Yeah. So we make these decisions, Carlton, on a day-to-day basis. Are we really incorporating these ethical principles as we're making these decisions?
Absolutely.
Love that. Lisa, have a community meeting with food. Food is always good, right? And find someone that has leadership. That's it. That's it. These are all examples of really being ethical as you're making your decisions in your day-to-day work. So what we really are looking at in domain 6 is, are we demonstrating healthy behaviors and self-care? These are also the other pieces of the domain. Recognize the importance of participation in professional associations and also demonstrate knowledge of the science of substance use and misuse. This is a big domain. It's a really important one. Let's move into some questions. Practice question number 1. What is the most basic guiding ethical principle in prevention work? Never encourage substance use. Take every opportunity to spend the prevention message. Do no harm. Lead by example.
A flood of C's.
And the C's have it. Do no harm. You guys, all, as I was reading that question, I was like, you guys all answered this question. There was so many do no harms as we talked about ethics. Do no harm is the most basic foundational ethical principle in our work. And it really aligns with the ethics that are identified in the IC and RC Code of Ethical Conduct for CPS. Really thinking about what are the potential harms of your strategies is really important. All right. Question number 2. In prevention work, when a prevention specialist's personal opinions differ from a coalition members on a relevant issue, what is the best way to approach the topic? Use position of authority to attempt to influence the member. Acknowledge internally the difference between personal viewpoints and professional, and uphold professionalism at all times. Tell the member you can no longer work with them. Find a compromise between the two positions.
Bunch of bees.
Well, golly gee willikers. The bees have it. There ain't nothing I can teach these people. The bees have it. That's it. Yeah. And this is at the heart of our work, is acknowledge this.
Mary Rose said break knees. I'm going to come after you, Mary Rose.
The views of the participants do not reflect. I love it. I love it. And this is so important. Really acknowledging the difference between personal viewpoints and our professional viewpoints, and really maintaining professionalism at all times. And we see this in our community work so often. We see different community members have very different viewpoints on the same subject, and we need to come together and really understand, what is my professional view versus I'm gonna close the door on my personal views as I'm working on my maintaining my professionalism at all times. Treating every community in which you provide services the same, regardless of their culture, is an example of cultural competence, B, cultural humility, C, cultural blindness, D, cultural sensitivity. Treating every community in which you provide services the same, regardless of their culture, is cultural competence, humility, C, blindness, or D, cultural sensitivity.
So there was a little bit of differences in the beginning, but now a flurry of C's, and even some folks that have come back.
Yep. See, whoops. Love it. It's exactly it. So cultural blindness is really that failure to recognize that there's cultural differences. And it really ignores what we really introduced quickly there was the issue of disparities and health equity, and that we really need to understand and be inclusive of cultural differences and understanding the uniqueness within populations within our community, so that we can be effective. And again, going back to that, do no harm.
If I could just add one more comment to this. I love that you included this question. This question is a real example of why we're sharing in your preparation. Part of this is the way we take the test or take the exam and go through the exam. This has really required us to kind of slow down and read the question thoroughly and then go through each one of those answers, as opposed to the first instinctual answer. And so I just wanted to just kind of share that and offer that this is part of the goal of these sessions.
Yeah, and I think, Carlton, I love that, because that question, this one, and the question about the $2 drink increase and that supply side, those were both examples where I had to really slow down, because I answered these questions before I looked at the answers.
Me too.
And yep, and those were two that I was like, because I'll tell you, when I first read this one, I thought it's A, and then I was like, nope, I'm reading it again, and I was like, oh no, this is really an example of cultural blindness. So if you were one of the ones that answered A really quickly, I was in that camp until I slowed down and read the question. And that is really, really important. Two things I want to say as we're wrapping this up. You know this stuff. Yep. As we had conversations about this today, you know the concepts, you know all about the piece of environmental strategies, you understand comprehensive strategies, you know how to make ethical decisions. Slow down and make sure that you're getting the best answer based on the way that they ask the question. So definitely, yes, Jules, read it, reread it, slow down, and then really take time on your answer.
Beautiful.
Love it. How are you feeling about, I mean, again, these are big domains, and in a really short period of time, we highlighted and did some practice questions. Any questions or thoughts? How are you feeling about domains 5 and 6?
And as folks are putting in their comments, I'll just simply share that, as Dorothy mentioned, we are the intent of these sessions were never to go into deep dives with respect to these topics or to train these topics in depth, but really it was to provide some exposure to some of the key concepts so that we might be able to have a thorough conversation about how these questions may be applied to a CPS examination process. And so I really, really appreciate that. For those of you who have identified areas that you want to go deeper in, there are opportunities to be able to do so. Reach out to the Southeast PTTC to be able to do so. We'd be more than happy to engage with you in those conversations. To my friends from Tennessee who are going to be participating in the study hall, we look forward to seeing you there with respect to that. I want to thank the state of Tennessee for making sure that we're providing that. I would offer to those of you who think that this might be helpful for some of your states to reach out to the Southeast PTTC as well. Lastly, could I ask you all just to give some kind of reaction at all to the wonderful Dorothy Chaney, who really helped lead this conversation today. If you wouldn't mind doing a little bit of a clap or anything, I just really appreciate you, Dorothy. Thank you so much for the investment of passion and conviction and commitment that you offered. And with that, I'm going to turn it back over to Amber to take us out and close us out and make sure that we're able to pay attention to some key items that she has for us now.